The nurse stared at the screen, then reset the cuff. She thought it was a mistake, a faulty machine. The second reading said the same thing. Blood pressure. 52/30. Not low. Just biologically impossible. And yet the woman was awake, talking, smiling. How was she alive? Let's get to the bottom of this. I'm a doctor. Let's meet our patient. And according to those who know her, Priya is extremely in tune with her body. A yoga practitioner who eats clean, sleeps enough, and runs every morning. She prided herself on her low resting heart rate and overall balanced life. Nothing seemed out of the ordinary until one day it all changed. Name Priya, age 34. She's a software engineer who lives alone. Priya started having these random episodes of dizziness, like when she stood up too fast or walked a bit too far. It was subtle at first, but over time, the feeling intensified. Then came the tunnel vision. Sometimes when she was walking, her vision would fade for seconds at a time, like the world was dimming. At first it happened randomly, and it happened more frequently. Everything seemed fine. She felt fine. Then suddenly her vision turned black. Then it started happening almost every time she left the house. Slowly, she had no idea how long she'd been on the floor. But as the day wore on, she started feeling dizzy again. And at the end of the day, she fainted again. When she finally got up, her legs felt weak and shaky. The lowest they'd ever seen was 26/12, despite the critically low numbers. She was fully conscious and talking. It was whispering, screaming even. She tried to tell herself it was just a passing thing. It's probably brought on by the heat, or maybe she'd pushed herself too hard at the gym. He chalked it up to an athlete's heart, a condition where the heart is normal, but the blood vessels are used to a lower pressure. It's common in athletes, especially endurance athletes, who push their bodies to the limit day in and day out. Her Apple Watch showed no heart rate data for 12 minutes. One day, her smartwatch warned her of a dangerously low heart rate, as low as 38 beats per minute. She was diagnosed with primary autonomic failure, specifically a form of pure autonomic failure, or PAF, a rare neurodegenerative disorder that attacks the autonomic nervous system, the part of the nervous system that controls involuntary functions, like breathing, digestion, and yes, blood pressure. So she remained conscious until the very end. She pushed through the sensation, trying to ignore it. After all, she'd always had a low heart rate, so what was the big deal? When she finally made it home, she collapsed on her couch, too weak to move. But when it happened again and again, she finally saw a doctor. The doctor checked her vitals and told her that her blood pressure was low, but not dangerously so. As the nerves wear away, the brain struggles to communicate with the body, leading to all sorts of involuntary functions to stop working properly. But Priya wasn't an athlete. She was a regular person just trying to stay healthy. Just a few days later, Priya woke up early to brush her teeth. Priya wasn't fainting from fear, weakness, or dehydration. She was disappearing. She stumbled to the bathroom, splashed some water on her face, and tried to shake off the incident. Her husband rushed her to the emergency room, where multiple blood pressure readings were taken. 40s/20s. They checked the machines, they tried different cuffs, same results. A cardiac workup was done and came back normal. Brain scans were clear. The doctors had no answers. Some assumed it was a psychological disorder. You're just anxious, one said. Another said some people just run low. But Priya knew her body wasn't just low. There was something deeply wrong. One night, Priya woke up on the floor. Her lips were blue and her fingers numb. She couldn't feel her legs. Her husband rushed her to the ICU. The seasoned specialist on call ordered autonomic testing, which revealed the truth. Priya wasn't just hypotensive. Her nervous system had stopped trying to control her blood pressure. It was too late for Priya. It destroys the nerves that connect the brain to the rest of the body. This can cause fainting, dizziness, low heart rate, vision loss, and eventually sudden death. In Priya's case, it had caused her blood pressure to drop to near zero, but her brain had adapted to the chronic oxygen starvation. What happens when the system that's supposed to keep you alive just stops trying?